Now to the pandemic and cases rising in nearly half the country. The upper Midwest hit especially hard. Dozens of hospitals in Michigan at 95% capacity. And globally, another painful milestone, more than 3 million people now dead from COVID-19. ABC's Rena Roy from Minneapolis.
Tonight, that staggering new milestone, 3 million people killed by COVID-19 worldwide. 3 million people killed by COVID-19 worldwide.
And globally, another painful milestone, more than 3 million people now dead from COVID-19.
It began in healthy-looking pigs, months, perhaps years ago. A new coronavirus spread silently within herds. Gradually, farmers started getting sick. Infected people got a respiratory illness with symptoms ranging from mild flu-like signs to severe pneumonia. The sickest required intensive care. Many died. Experts agree, unless it is quickly controlled, it could lead to a severe pandemic, an outbreak that circles the globe and affects people everywhere.
The mission of the Pandemic Emergency Board is to provide recommendations to deal with the major global challenges arising in response to an unfolding pandemic. The board is comprised of highly experienced leaders from business, public health, and civil society.
We could be looking at double the number of cases in 1 week and 16 times as many in a month if we are not able to stop the spread. Number of cases in 1 week and 16 times as many in a month if we are not able to stop the spread. Number of cases in 1 week and 16 times as many in a month if we are not able to stop the spread. That would be on the order of 500,000 cases, and it would continue to rise exponentially. In 3 months, we could be approaching 10 million cases.
We're at the start of what's looking like it will be a severe pandemic. And there are problems emerging that can only be solved by global business and governments working together.
We have known about CAPS-like viruses in animals and people for decades. About having a vaccine in time to be relevant during this pandemic.
So the policy crisis in question for this board in this meeting is this: how should governments, business, and international organizations allocate and distribute pandemic antivirals and medical supplies to the people who need them most?
What we've seen work very well in the HIV field is, in fact, procurement through the Global Fund. So having a centralized mechanism, so financially able to procure on behalf of affected countries is critical. I think the second thing is it's going to be very important that for the business sector, for manufacturers of antivirals, that we have clarity around what the need is and where the need is and who are making the decisions.
I think that given that the countries most affected are those that are low and middle income countries with unequal access to technology, to finances, the UN has a worldwide footprint, universally recognized, and universal membership.
A global stockpile would certainly help ensure more rational and strategic allocation, but the reality is that we don't have the logistics capability, even within the UN, to bring that together in one place and run it. So this is where I think a collaboration between the international organizations like the World Health Organization and the private sector, which runs these supply chains for many purposes every day, understand where the supplies are, make smart decisions about how to allocate them to the people who need them in the places that need them the most, and then work with the industry to move those supplies from where they are today to where they need to be.
Just to underscore the point that cooperation among supply chain providers or businesses that have huge supply chains can add a lot of efficiency to the whole process.
The question is, can we, through this international mechanism, really promote commitments to doing this as quickly as possible and give people a sense that actually if they contribute more, that they will have a better chance of protecting their own populations and their country's security and health.
So to be completely clear, most of this production would already be committed in contracts.
Yes.
It is almost unheard of that people are producing product without having a forward commitment for the consumption of that product. So the first thing that needs to be done, because this is not something that countries currently control, and this countries are going to bring about emergency situations and co-opt an existing supply chain.
I think it's not likely. I agree that countries are not going to buy countermeasure to put into a global supply without retaining a large portion of it for themselves.
Public health agencies have issued travel advisories, while some countries have banned travel from the worst affected areas. As a result, the travel sector is taking a huge hit. Travel bookings are down 45%, and many flights have been cancelled. A ripple effect is racing through the sector. Governments that rely on travel and tourism as a large part of their economies are being hit particularly hard.
How should national leaders, businesses, and international organizations balance the risk of worsening disease that would be caused by the continued movement of people around the world against the risks of profound economic consequence of travel and trade bans?
If there's some sense that there's a UN institution that can do all of this, then I
And globally, another painful milestone. More than 3 million people now dead from COVID-19. 3 million people now dead from COVID-19.